everybody, and welcome back to Bottomless Coffee with Jerome. In this episode, just like the last couple, I want to give a special shout out to Advocates for Better Health and the Minnesota Department of Health. This is cold season, so COVID, flu, colds, these 100-day coughs people are getting. Just do yourself a favor and get boosted or vaccinated if you can do so, okay? Now, today we are talking with a public health change maker. Dr. Abiola Abu-Bakr is the founder of Conduit for Collaboration Consulting LLC, a healthcare equity, innovation, and strategy consulting firm. She holds a clinical doctorate in public health nursing. Hmm. She holds a clinical doctorate in public health nursing and combines her expertise in health justice, public health, policy, and nursing with evidence-based practice to support change management, enhance patient experiences, engage communities, promote equitable practices, and engage health outcomes in communities both local and global. Whew. Welcome, Abiola. How are you?
I'm well.
Oh my gosh,
Yeah.
you're doing a lot.
As you're reading that, I was like, "Oh, yeah, yeah, okay. Who are we talking about here? Who's doing all that? That's crazy."
As always, it's such a privilege to really have these conversations with people who are doing significant work in our communities. And I just love to figure out, like, how did you come to do all this? Like, how did you come to public health?
Yeah, so, public health was a decision I made later on in life. So, I am Nigerian American.
She is not old enough to say
Yeah,
that later
so
on
I'm
in
gonna say later on in life,
life.
you know, later on in my very long life, yeah. So I am Nigerian American, and growing up, the options are very much you're gonna be a lawyer, you're gonna be a physician, or you're gonna be an engineer.
Mm.
And my parents never explicitly said that, but everyone in my family on both my mom and dad's side were somehow related to healthcare. So lots of physicians in our family, majority physicians in our family,
Mm.
and then some healthcare administration and other pieces like that. So I was very much in my mind like I'm going to be a physician. That's what I'm going to do. I'm going to be a doctor. And then in high school, I had this really great opportunity to do a program called Amigos de las Americas, where I got to go to Nicaragua for a little bit and do some collaborative work with youth in Nicaragua. So I learned a
Cool.
lot about like their culture and how they engage in public health as youth. And I got to just like literally, I was taken for a ride, like, "Yeah, I get to come too and do this cool stuff with y'all." But it was in that experience that I learned a lot about public health and what public health was and other ways to look at the healthcare system. And that's when I started thinking, okay, what are routes to public health I'd find interesting? Nursing came up, and I was like, I could do that. And then was in nursing school, and I was like, yeah, this hospital thing, not my cup of
Sure.
tea. But the public health, like I remember my public health rotation in clinical, I was like, can we do this all day long? Like, why are we bothering with the rest of this? So
Good.
that's how I got into public health and got really excited about public health.
That's wonderful. And then what took you to creating your own consultancy?
Yes. So I have been a consultant for 8 years now, which has been really exciting and doing healthcare consulting. But it actually started when I was in graduate school. So I got my doctorate degree in public health nursing, so advanced practice public health nursing. It's a clinical doctorate for nurses. And I was doing a lot of community based work. So I was lucky enough to be doing my doctoral degree here in Minneapolis, where I grew up, where I was raised. So I had lots of community connections. And a great friend of mine, Clarence Jones, who you've
Yeah.
had on the show, um, we met through some work I was doing at the University of Minnesota in their programs in health disparities and research office. And he was like, would you be interested in like coming and doing some work with me at a federally qualified health center? And I was like, yeah, is this a dream? So I got to working with him and really being able to get out into community. I was pulled onto a project called the Clipper Clinic,
Okay.
which he was running at the time was a mobile unit. We'd go out to barber shops and really support people with heart health. Blood pressure readings, all of that fun stuff at barbershops. I got introduced to so many great people. But in that, I started doing my own consulting work. So
Okay.
he'd bring me on to different projects and I'd get to use my know-how and my skill set, not only as a nurse, but also in my public health realm to really address some of these wicked problems that we're seeing, which is how do you make primary care accessible to everybody? How do you ensure or work to ensure that the hospital is really set up for tertiary care, or is really looked at as a safety net? And how do you support people in getting as much health care as they can in their own communities before having to go to a hospital system? So it was in doing all of that work that I was like, oh, I know some things.
Is that the heart of what you're doing now? Is that the heart of CCC?
Yeah. So
Do you call it CCC or did I just give it a
yeah,
name?
I call it C4C,
Okay, okay.
but it's close. CCC was a contender, actually. So, the heart of my work as a consultant has really been to take all of the great experiences I've had in community here locally, but also across the nation and the world, and really package that into a collaborative effort. So, my big thing is all about collaboration. So, it's like, okay, how do I do all of this healthcare stuff and the public health stuff, but from a collaborative lens or from a social justice lens as well, but really looking at collaboration and being like, I know so many great people who do so many great things. How do we bring it all together to
Yeah.
solve these wicked problems?
And is that working? Because
I we gotta check now. Yes, yes, it
okay.
has been. We've had so I've been doing this for 7 years. I recently went into full-time consulting just this past year. So I was doing a lot of
Okay.
work on the side of my 9 to 5 for the past 7 years, or for the 6 years, and then seventh year I was like, this is full time. I'm doing it full time now.
Mhm.
And in this last year, I've been able to work with some really great new partners, and I just got reports at the end of last year about how much change we've been able to make in some of these clinical networks we've worked in. So we've seen an unprecedented increase in population health outcomes for one of the clinics that we've been working with, for them to really increase vaccination rates for a lot of the BIPOC patients that they're serving. And then
Beautiful.
also some really great culture change as it comes to as it relates to how providers see themselves as agents of change for health equity in their own work. So
This is really interesting for me, and I'm going to set it up for you because we've been doing this show for maybe about 2 years now, could be going on three. And I'll have individual conversations with leaders in organizations or healthcare professionals or doctors. And I'm like, oh, it sure would be nice if someone were bringing you all together and you were all working together on these problems that you've all identified.
yeah.
And that's why I'm like hopeful and excited. Is it working?
Yes, yes, it is. It is. I have if people go on my website, I have like a collaborative approach that's on there. And then I also list a lot of the people I work with. So my big thing is that I bring in friends who are experts in their own rights and other people who are great collaborators. I bring them in as subcontractors on a lot of the work I do,
Okay.
because I'm the type of person who I'm like, why would we put one brain towards this when we could put multiple? And I also know my lane, right? And I realize like this is my lane and I can't be in every lane at once. But what I can do is bring in people who know their stuff and we can work together because it makes it so much easier
Yeah.
and we're not reinventing the wheel. And then you just get a breadth of ideas, but it also supports equity, right? And that equity lens and the solutions that we're working towards with community when you have a diversity of experiences and voices and lived experiences.
Yes. Well, let's dive into an example. You brought up Clarence Jones earlier, who was our previous guest on the show. And I want to say the theme of his conversation, or our conversation, was about the way he works behind the scenes in collaboration and partnership. And so, like, how are you and Clarence working together, or did you work together in your COVID response? Let's say.
Yes, yeah. So Clarence really pulled me into a lot of COVID response work, which was great. So I had just gotten back into the country at
Oh,
the height of
which country were you in
yeah,
this time?
yeah. I was doing a fellowship in Uganda with their Ministry of Health,
Amazing.
and I got to do some really great work around Ebola and a lot of mental health work around Ebola and just being able to work with communities to limit the spread of Ebola and also just help people understand how the disease worked.
Or is
Um,
that all just
just that.
combating Ebola in Uganda?
And then came back to the US in the midst of COVID and was like, yeah, this is a thing happening. And I just remember feeling like, okay, I'm back in Minneapolis. I've been gone for almost a year now. Like, what's going on? I want to support in some way, but like, how do I engage? And it's just like, duh, Clarence Jones.
Mm.
So Clarence actually had reached out to me and he's like, where are you in the world? Are you back yet? And I'm like, yes, and I'm ready. So he brought me into some really great work around COVID vaccinations. months, actually. That was really fun and exciting to do. And we were at that point where the vaccine had recently just come out, and everyone's like, "Yeah, I need to get this vaccine. I need to get this vaccine." And a lot of the work that that Clarence brought me in on was not only are we supporting people in getting the vaccine, but also how do we support BIPOC communities in
Mhm.
access to the vaccine? How do we address BIPOC communities so there's a way to share information from trusted sources about what's in this vaccine? Who was it tested on? Did
Yes.
people who look like us, were they part of the clinical trials? Um, will we have some type of priority as we like as our elders come in and get it, like, right?
Yeah.
So much going on. So I got to Clarence pulled me into the vaccination work, so I got to in provide and administer vaccines. And I also just loved how he did it because he was so intentional. We were at a site in Brooklyn Park, and he was so intentional about understanding that community.
Mm.
And he's like, okay, who lives in Brooklyn Park? And when I think about Brooklyn Park, I always think about all of my African aunties,
Okay.
right? So he's like, we want this clinic to be so representative of that. So he brought me in and some other great nurses in partnership with another organization. But then he also made sure like the staff who was in the parking lot was representative of us, right? The staff who was supporting people into the room where y'all got vaccinated looked like us, who was checking you in, because there's this whole piece around fear, obviously, with the
Yes.
vaccine. So he wanted people, as they came in, from the first person they saw to be representative of them and their community. So it alleviated a little bit of that fear. Like, I'm not walking in somewhere where no one looks like me and now you want to poke me with this needle. What's going on here?
Right.
Right. So he was very much about thinking about all those aspects. But
That's wonderful and so impactful. And I
mhm,
feel like maybe Clarence undersold himself a little bit when he was sitting in that chair over there.
not surprised.
Humble. He's too humble.
Very.
Okay, so then that was back when the vaccine was just rolling out. Are you
Mhm.
still engaged in COVID work, or have you pivoted to something else?
Yeah, so there's still some COVID work going on. I don't want to say some. COVID is still very much ongoing. So there's still work around being able to support Clarence and his organization and the work they do around spreading information, helping people understand the boosters even that are coming out and when to get them, where to get them.
Yeah.
So he's always sending information out, and I work as a vehicle to pass that information on to others as well and supporting in those ways. And then in addition to that COVID work, have also now been able to spin off into other areas. So a lot of the work I do or focus on right now is around birth work.
Oh,
And then I also do my consulting work, but really being able to bring that COVID piece
yeah.
into birth work, and make sure it's important in that space of like, okay, you're pregnant. What does that mean? Have you had your booster? When people are visiting you, different things to keep in mind, especially as we see these surges, but always keeping COVID at the forefront
Yeah.
of whatever work we're doing, whether we're talking about health equity and inequities or we're talking about maternal health. Like, how do we make sure that we're involving COVID in that conversation? Because it's still part of the conversation.
But it has to be one of so many things. Like even as a gay man, so very far removed from pregnancy and the birthing process and everything. I know I'm like, this is a lot. There's a lot going on.
Right, right.
My sister-in-law, she's got pregnant, she had a healthy baby and everything. But it was basically like she got pregnant and then 9 months later there was a baby. And I like that missing 9 months, kind of like the before times in
Yeah.
COVID, I was like, I
Yeah.
don't know what happened. How did I get here? I have no idea. And so you in your business in supporting maternal health, it sounds like maybe also with an emphasis on Black maternal health, which I know is a point of some concern
Yeah.
for us. You're working on not just COVID stuff. So
Yeah.
what's that about?
Yeah, so I have an organization called a BA Collective that I run with my sister, Ade Salami. So in 2020, we both,
I've heard of this.
yeah, I hope so.
Okay.
In 2020, we both had the opportunity to become doulas. I feel like everyone had some type of growth during that
Yeah,
year,
yeah.
right? And ours was becoming doulas. And my sister was like, okay, now that we're doulas, what do we want to do with this? And I was just like, let's just work in our circle of influence to support birthing people who we know. And my sister's like, think bigger, let's
Okay,
create an organization.
your
And
family.
right. And she's like in the policy world. So she's like, let's create an organization and like, let's make sure that we're supporting people who look like us because we understand the numbers around maternal health outcomes in this country and how they disproportionately impact people of color, specifically Black birthing people and Native American birthing people as well. So she's like, we have an opportunity to set up a business that really has that as its cornerstone
Hmm.
and make this happen. And I shouldn't miss out on the opportunity to also share that when this was all happening. So this was um, May of 2020 that we went through our first doula training. And it was our first day of doula training that Mr. Floyd was killed. And he actually was killed a block away from where me and my sister lived at the time. So we are both with our parents around that time because COVID.
Right.
So that had happened in the midst of our doula training. And I think that also just informed so much about our business and what it became because there was this big piece of us that's like, obviously, Black Lives Matter, but not just as we're grown adults,
Hmm.
but from birth, they
Hmm.
matter and should matter. So how do we look at Black Lives Matter across the continuum of like the lifespan? And for us, we really felt like our role in this work and in this movement was in the birth space, right? How do we make sure that as we are brought earthside, it is done so with the utmost respect, but also joy because
Yes.
we deserve that.
Yes.
And all of these things. But how do we bring joy to the intersection of so many nuanced and complicated realities of giving birth as a non-white person in the system?
First off, I want to just say that was an incredible answer to me. My question of what's that? I'm like inspired. But then, secondly, I am just rolling off the Public Health Advisory Committee at the City of Minneapolis, where we identified racism as a public health emergency. And in collaboration with other committee members, their big concern was kind of like, racism is a really big problem. I don't know what we can do about it. It was a lot of admiring the
Mm,
problem instead of
mhm,
beginning to work on solutions. And so the new chair of the committee identified at some point the opportunity for a case study for
yeah,
evaluating the entire life of a person
mhm,
and then looking for points of intersection where we can intervene in a positive way for really transformative outcomes.
yeah.
And so it sounds like if there's any opportunities to support your business with your sister,
Mhm.
we should make sure we steer those opportunities your way.
Yes, yes, please. And first off, thank you so much for like the work you've done on that advisory council. Like that's so important, and I'm happy to see the city moving in those ways because it's like living here my entire life.
Yeah.
It's taken a long time, but it feels good now to know that there's community members who actually understand our communities and what's happening, and who can amplify the voices at that level and be able to say like this is what it should look like, this is what it can be. So thank you for that work.
Also fun to, I guess, share that I rolled off of Public Health Advisory Committee and almost immediately into what's called the HEAL Council.
Yeah,
And I saw that you were, I know, I waited to tell you.
yeah, yeah.
'Cause our first meeting isn't until next week, so I don't know what all is going to be involved.
Yay. Okay, this makes me so excited. I'm like, yes, go.
Good, good, yeah.
Yeah, yeah. Heal Council. Love the Heal Council. Um, but yeah, I'm like, I can't even remember where we were because that just made me so happy
Oh, good.
to know that you're in that space as well.
We were just talking about lifting up other people, but you know what? This is a really great time for us to take a quick coffee break,
Yes.
and we will be right back with Dr. Abiola Abu-Bakr. Okay, this is Bottomless Coffee with Jerome. We are having a fantastic conversation with Dr. Abiola Abu-Bakr. Now, I'm going to ask you about a paper that you wrote. It's from 2021, and it's called Unconscious Bias and Its Impact on Public Health and Healthcare Systems, which is a lot. So I make this one might take a little bit. I'm excited for it. But what is it that you saw or experienced that prompted you to write that article?
Yeah, so that article was published in 2021 and it was actually written in 2020.
Okay.
So clearly lots going on. We're just all witnessed the murder of Mr. Floyd. We're in the midst of a global pandemic. And especially like here in Minneapolis, in a lot of our communities, the conversation was happening around racism. And then in my own circle, it was, or in my own field, it was around how does racism impact healthcare?
Mm.
And what I noticed was happening so much was people absolving themselves of it,
Oh.
right? We are we are the prolific healthcare providers, which yes, amplify and shout out so many great health providers in the midst of the COVID pandemic. But it was just a sense of like, we can do no wrong, and that includes racism.
Mm.
And that is very much a public safety issue and doesn't fully touch our field. So at that time, there was more and more people adding literature um, around how racism and public health intersect. But I was like, I want to look at this from the lens of unconscious bias because that's often a starting point for understanding racism is first talking about unconscious bias. And I felt like it was a space that a lot of my colleagues had not yet were not aware of or didn't do their homework on it yet. So it came from that space and also just a lot of coaxing from some good friends who were like, you should publish something.
Oh, okay.
So yeah, so that's how that all got to be. But it was just, it felt really important to have an article or publish a paper that really spoke to this is how racism, yes, but also unconscious bias impacts our healthcare system, which also means this is how we as healthcare providers promote unconscious bias. And that then leads to racism, or we promote these systems and these cyclical systems that hurt people.
Does your paper speak more to the individual provider behavior, or does it speak more to the systems um, within which they operate, or is it some combination of the two?
So I set out with it wanting to be a combination of the two, but it mainly focuses on the systems,
Okay.
right? So it really focuses on the systems lens, which you know me, I love playing around with systems.
Yeah.
So it's really at a systemic lens of saying, if this is the context of our history as a country, right? We're talking about public health systems in the context of the United States. We can't look at that without considering the context and role that racism has played. And that also creates a narrative in people's minds about unconscious bias and what that means and what that looks like. And how do you just the average provider sitting here, what does that have to do with you, right?
Mm.
And how does that impact the care that you're providing? How does unconscious bias impact the care that you're providing without you even knowing, right? That's the unconscious part. How is this system set up in this very specific way for it to just happen, for it to just spit out the outcomes?
Yeah.
And that was another piece is that as conversations were happening in the healthcare system around racism and unconscious bias, a lot of the conversations were like, well, it's systemic, right? And it's just as if the system is this big machine that's just spitting out these outcomes. And a really good friend of mine, Dr. Tamika Lashige, always says systems are people. So the paper was also trying to get a little bit at that of like systems are people, we are the system.
Yeah.
So it's not by so many people say this, right? It's not by design. Well, it's
On
not by
purpose.
accident. It's by design that this is happening. It's not just like, oh wow, we put um, a black birthing person into the system and it just spit out premature death
Mm.
for their baby. That's crazy. I hate when the system does that. Hate it, right? It's like,
Yeah.
no, we play a role in this. And it's very unconscious at this point, but we can become conscious of it and change.
It's unconscious bias is so interesting because I have limited personal experience with the healthcare system. And for me, I'm like, well, is that because I'm black? Do I have something underlying? Like what's going on?
Right.
But in a previous conversation with Dr. Tom Kotke, like it just happened on the day after there was a bat in my bedroom,
Mm,
right? And so he was like, well, standard practice, Jerome, is go get the rabies shot afterwards, no matter what. And I was like, got
mhm.
it. No problem. Here to live. And so I went to the doctor. Well, no. I called, and this is an emergency situation. And they were like, okay, like 7 days, it'll be okay, and you'll be fine, and we'll get you in. And I was like, after a while, I was like, 7 days seems weird because for my dog, they were like, bring that dog in immediately.
Mhm,
This is very
mhm,
Minneapolis. Like,
mhm.
stop what you're doing, quit your job,
Yep.
whatever. Get that dog a shot. And I was like, I'm pretty sure that's the priority that I should have. So I called back and someone had that same vibe. It's like, good, perfect. So I go to this urgent care. It turns out it's the wrong place.
Mm,
And I'm like, okay. I'm beginning to understand a little bit of the frustration. But then the doctor was like, "I'm gonna see you anyway." And he's like, "Look, here's a little chart, and you really don't need to get this until the bat is tested."
Mhm.
He's like, "It's really expensive.
Mhm.
It's a little painful. It's whatever." And I'm like, "I have an HSA.
Mhm.
I'm like, I would like to sleep well tonight. Why
Yeah.
don't you just give me the medication that I'm asking for?"
Yes.
Right? Now I left the day without getting it, and everyone will be happy to know the bat was negative.
Mhm.
So, woo.
Yeah.
But it could have gone the other way.
Mhm.
Like, what if that bat had been rabbit, and then I'm having to go back to the doctor, or God forbid, I can't get in, or there's some problem with the medicine or whatever. I was like, this system sucks.
Mhm. Mhm.
And so when you say that people are absolving themselves in the
Mhm.
system and that everything is it's fine, I'm like, the system isn't that great anyway.
Mhm.
And so I'm not at all surprised that there can be racist outcomes, and it it boggles the mind that people who are so well educated and professional don't think that their system could use improvements.
Yeah. And it's crazy because when you talk to most providers out there, they'll tell you, like, yeah, there is an issue with our system. And I think, if anything, that's what really drives me up the wall. I lead this session in my consulting work. I lead this session, Health Equity 101, and then
Oh,
another one is Health Equity in Minnesota. And I love both of them. I mean, I love all of the ones I do,
okay.
but those two especially, because in the Health Equity 101, it's like, okay, let's just talk about what these words mean, right? Because they've been thrown at you. Cool, cool, cool. And then we get into health equity in Minnesota, and it's like, how does this relate to the state of Minnesota? And you'll see in our history, especially through the Department of Health, from as early as 1985 or even earlier, like the 1980s, the Department of Health has said, yeah, there's an issue when it comes to racism in health, and we're noting that. We're gathering information on it. Nothing is being done,
Hmm.
but we're noting it, right? And then we get to 2014, and we have that breakthrough report to the legislature from past Commissioner Dr. Ed Ellinger that finally said racism is leading to negative health outcomes for Minnesotans, right?
Hmm.
That's the first time it's ever been said. The Department of Health has been gathering data on this from the 80s, though. And then you get into a space of like, okay, these are the things we're going to do. But even from that 2014 report to now, we still have so many inequities. So we're
Yeah.
really good, especially in healthcare and especially here, we're really good at naming the problem. We don't have any issue with that. And it's about the action part and changing it, right? That
Yes.
we're like, system again, though. We named it, we saw it, we see it, we see you, system. But who's going to stop you? It's
Yeah.
just the system at it. So your experience that you just shared is a great case study, right? Of a lot of what I get into in that paper, which is just about when we have this unconscious bias, it's not just in this moment that I think this way or I'm just this type of person. It's that I've been primed with narratives and prejudice ideologies and discriminative ideologies around certain types of people, what types of care they should have access to, what
Mhm.
types of care they can afford,
Yep.
how I respond to their needs. And it's all based on my lived experience. It's all based on my cultural background. It's all based on all this priming that's been done.
Yeah.
And it's been done in such a covert way that I'm oftentimes not even fully aware of it. If someone were to say that is a racist action, of what? No, no. But it's like that's why it's unconscious. And
Yeah,
that's why it's
like, I appreciate you describing to you letting them know, like, unconscious means
yes,
you
right?
don't
You're
know that you're doing
unconscious of
it.
it, but you're doing it. And on your own time, I really need you to sit with that. Right now, on our paid time, I need you to be aware of the fact that there is a very clear procedure and protocol, and every single person who comes in here with this issue should get that exact procedure and protocol.
Yeah.
And it shouldn't be well, it's a really expensive shot. Can you afford it? Because what?
Like, I really don't care.
Yeah, no, and then, like, go talk to the drug companies about that. Don't talk to the
Yeah,
patient
yeah,
who
yeah.
might need this, right? No.
And I will I do actually I should follow up. I'm like, "Why is that so expensive?"
I remember I went to when I was going to Nicaragua, that's when I first was like, "Okay," they were like, "You might need to get a rabies shot just like as a if anything comes up,
Preventative,
yeah,
yeah.
preventative, or like if anything comes up while you're there. And then that's when I've learned that the rabies shot was so wildly expensive here. And I remember going to Thailand, and I had to get some shots. It was much cheaper to get them there than here
Oh, funny.
for some public health work I was doing. And the rabies shot was much cheaper there. And I'm like, what's going on?
See, I missed an opportunity. I could have gone to Canada. I could
See,
have gone to Mexico.
got the rabies shot. What are you doing messing around with our healthcare
I'm
system?
like, with that, could I put that through on the HSA card?
Yeah, yeah, right. It's an international expense, but it's for my health.
Well, okay, as part of your consultancy, maybe moving away from racism a little bit, maybe not.
Mhm.
You do speak to the information and resources that people need to live healthy lives. And so I would love some health tips. What are you talking about? What's going on?
What's the information?
Yeah, what's the good stuff?
Yeah, right. What is behind this paywall of academia and
Yeah.
degrees? So I always am telling people like I want everyone to have access to like the information and the tips and knowledge to live a healthy life. And what I mean by that is I want everyone to have access to the information I was given in nursing school. I want
Mm,
everyone to have access to the information I was given in my doctoral program. I want everyone to have access to the information I'm given in my MPH public health program. Like none of this information should be something that the average person who is living very much in their body shouldn't have access to. I think about like it's kind of like you get an iPhone, but you don't get the instructions to it.
yeah.
And they're just like, "Ooh, you got to pay for those." Not telling you how to turn it on, not telling you how to use it, not telling you much, and you have to pay into that knowledge. And that's absurd. What? I bought the phone, right? So
Yeah.
we're all here. Why don't we have the manual? So that's why it's so important
That
for
is so profound. And I'm just so annoyed with myself for taking so long to like, yeah, wait, why isn't that just available?
it's wild. When you think about it for too long, like I have,
Yeah.
you're just like, that's crazy. Like, am I currently profiting off of it as a provider? Yes.
Capitalism.
Right? And at the same time, am I going to I especially do this in my doula work where I'm like, I know our contract is done, but still call me if you need anything, right? Because this knowledge should just be available to people. You shouldn't
Yes.
have to pay into it. If you need to better help understanding heart health and all the components of it. What does it mean when they say the systolic and diastolic for your blood pressure at the clinic? What does it mean when they tell you that your antigen level is this? Like
Mm,
that type of information, I want people to have like access to it and I want it to be readily available. I want it to be accessible. And when I say accessible, I mean not just I'm saying it, but it's being said in a language that they understand. It's being written in a language that they understand. It's being said in a space that they would already be going to.
yes.
Like, how do we really make sure that people have the manuals to the bodies that they're living decades in?
Oh my gosh. Yeah. It's you're like uncovering I guess uncovering or creating, or I'm manifesting an insecurity now. I'm like, oh my God, I don't know. Like, because I have these conversations so frequently. And I'm like, what are some healthy tips? What can we do to be living healthy lives? And I'm like, I think I'm good. Or am
Am I,
I?
right? And I'm like, there's so many tips, right? As so
Yes.
many of your guests have shared, right? It's like, yes, eating this amount of vegetables is really good for you. Switching this in your diet, limiting your amount of sugar reduces inflammation,
Yeah.
right? Wearing a mask, things like
Yes.
that. But it's like, I want people to feel how we readily got information about COVID, where it was just like, I don't have to go to the doctor's office to learn how to how I can avoid COVID, how I can actively avoid it every day, what happens if I get it. I didn't have to go into a doctor's office to learn any of that,
Yeah.
right? It was free information that was circulating. How do we do that about every other aspect? Reproductive care. How do we do it about heart health? How
Hmm.
do we do it about like literally everything under the sun, sexual transmitted disease, right? Or not disease, but infections. How do we do it for everything?
Asthma. Asthma. I on the
Okay.
public health advisory committee. No one really engages with those communities who aren't like kind of in the know.
Hmm.
And so when we had a member of the public say, everyone I know has asthma in this neighborhood, but not in the other neighborhoods for some reason. It's always the kids here who get it. Like, what's the cause? I'm like, do you not know what causes asthma?
Yeah. Yeah.
And they don't.
No.
They don't. I'm like, oh, okay. Well, you changed your filter. Vacuum your carpets. Why are you burning candles 24 hours a day? Like there are things. Is there mold in the house?
Mhm.
Maybe.
Mhm.
And so I forget sometimes that
Mhm.
things that I just know are not available to everyone.
Yes.
Like however it is that I learned it, I don't know how I picked it up. But there should be like a central repository of information where
Mhm.
everyone, because it's not taught in school.
No, oh,
And wouldn't that be good information? Like if we know that there is an issue with asthma in this neighborhood, then shouldn't the school be teaching the kids like what causes asthma and how to avoid it in the home?
yeah.
That system would make sense to me.
It would, and that would be really okay, wait, I think you're onto
I'm
something
feeling
because
good
'cause I'm
about
like, "That's
this.
a really good idea." Because then it's like, how do then students start creating policy?
Yeah.
Right? Because it's like, if there's so much asthma going on in our community, of course, the things that are in our lived environment play a part in that. So, what's happening in the school? When was the last time the school had the repairs it needed,
Yeah.
right? What's happening in our communities? Is there a trash, like, site next to us
Yes.
that's constantly burning in an incinerator?
Yeah.
And that community 5 miles down the road doesn't have that. So we're breathing in all these like all this particulate
Mhm.
matter that's increasing like our exposure and causing asthma. And now what can we do about it? But right, like it goes back to all the basic things that we talk about around like community led change, especially in the health space,
Yes.
is that it goes so much further when it's carried and led by the people who are experiencing it. But then we keep putting all of these barriers in place, like I don't know what causes asthma. So what am
Yeah.
I gonna do?
And then collaboration, which is at the center of your work. Let's just take that example with asthma. How would you engage with communities or businesses or
Mhm.
policymakers or whomever as part of your work to affect change?
Yes. So many options here
Yeah,
because
good.
it all depends on who contracts me first now. But it's like I can work with community groups, right? So if there's a community group that's already meeting around health or whatever it is in the community, like how do I engage with that group to really understand who's really driving this here? Like what kind of connections do you already have in this community? Who lives in this community, right? Like we know your city council member lives in this community.
Yes.
Who's connected to that person? Right? And then so you have this community and you're building capacity to say like who can really carry this, who can really speak up on behalf of this. So that's a lot of the work that I do to support the building of capacity. Shout out to my sister who is a policy whiz and has taught me so much I know about that. um, but then there's also pieces of like working with legislatures and all of these politicians to
Mhm.
say like, right, if we're going to do a campaign and we're going to have a writing campaign about the causes, like all the things that cause asthma in our community, right? Social determinants of health, all of these different things. And I'm going to make sure I'm pulling in people. So we have community members who may not be connected to the healthcare field who are writing into their local politician. We have members of the healthcare field, right, who are writing in, want to get people from all different levels of society
Yeah.
and all people who are impacted in different ways by this. So it's not just like these are the health issues, right?
Yeah.
But it's also like, this is how it impacts my livelihood. This is how it impacts my want to live in your ward, right? This
Yep.
is how it impacts whether or not I'm going to pay those taxes or if I'm going to push back on that. But just really helping local politicians understand all of the different aspects and voices to really bolster their support around an issue. And then, like, from an organizational level, it's just like, well, if you are a corporation and you have all of these dollars
Yeah.
and you happen to be a healthcare corporation, right? A lot of that money, especially for Medicaid funding, a lot of that money should and can be used in community. What are you now doing, right? You have this great health plan, you have all this Medicaid funding. All of these people may not be your members, but you know what they are?
Yeah.
Connected to your members, families of your members, right? People who are also impacted by asthma, your members are amongst them. So if this area of the city is impacted by asthma, how do we leverage your positional power and financial abilities to support us in creating a solution here that supports your own Medicaid members, but also just supports an entire community? Right? So
Absolutely.
there's so many ways to go about it. And that's why I love this work, even working with providers and clinicians. How are we talking about asthma in a visit, right? When is it being brought up? Who is it being brought up to?
Yeah.
What are our standards around it? How are we testing people? How are we bringing in public health, right? How are we bringing in public health nurses who are working in that area? Are they providing people information on how to report these different things? There's just so many opportunities. And now I'm just getting excited, like,
I feel
who needs
better.
asthma help right
I feel better living in this city, in this community, knowing that you are doing this work and knowing that like this business is available for the organizations in this work who have been on this show,
now?
who I know want to be engaged in this work and who want to make our communities better. That's
Mhm,
wonderful. I will also give a special shout out to your note on relationships with politicians.
mhm.
And I will just mention, even though I have run twice and lost twice, I still keep a good relationship with the people in power because, a one phone call from me is probably equal to like 100, 200 letters that they might
Yes.
receive to their office. So,
Yeah, and that's
yeah,
why, like,
that
right,
relationship matters. It really
so
matters,
much, so much, and that's why we would pull someone like you into the collaborative effort because it's like you have that capacity, that social capacity.
especially if it's to lift people up. Happy to answer
Mhm.
the phone.
Yes, yeah. So
Okay.
that's what I
Well,
love.
let's be right back with Dr. Abiola Abu-Bakr. Be right back. Don't leave. We'll be right back. Welcome back. You are watching Bottomless Coffee with Jerome, and we are having an exquisite conversation with Dr. Abiola Abu Bakr. Oh, I honestly, it's just been the vibes are immaculate.
Good, yes.
it's
Yeah.
it's wonderful. And what I
Likewise.
really want to do is give you this opportunity, make sure we didn't miss anything
Yeah.
because we weren't all over the place, but we were excited.
Mhm,
And so
mhm.
I just want to make sure, is there a message that you want to make sure that people leave with today?
Yes, and my message is collaboration is key.
Yes.
That is my message, and it so perfectly just, ties, into my business. But overall, like, businesses aside, collaboration truly is key. I think we have seen how far we get when we put all of our minds together
Mm.
and apply them, and when so many different people are represented at the table, it automatically solves for so many of the equity issues that feel overwhelming sometimes. And it's just like that diversity of perspective, but also of lived experience, race, gender orientation, sexual identity, all of these different things. When we collaborate with people and we collaborate with, most importantly, people outside of our of our sector and of our profession, we are able to address these public health issues and all issues from a more robust
Now, is
stance.
that what it's like when you're working with clients? You have maybe the client meeting and then you're bringing in people from all over?
Yes, so that's something that I get really excited about is that let's say, like, in a client meeting and we're talking about maternal health, right? And they're a client who's a community organization and they really want to just move the needle on maternal health. What does
Mm.
that look like? What can that look like? And I'm like, okay, I can bring in our policy expert who I subcontract and can talk to us about what does this look like from a policy piece. And that doesn't mean drafting policy, but that means, like, what can this look like? What are different ways to get maternal health on the ballot? Who are the politicians and legislatures who understand it already, who we can
Hmm.
amplify and who can support us in all of this? Or it's like I can pull in someone who I'm really close with, one of our experts who is like a Medicaid whiz.
Oh, good for them.
Right? Yeah, right. Because it's so confusing. I am like, how does this work again? And I've worked in Medicaid, but pull that person in to say, like, okay, this is, if we're talking about maternal health, these are all of the resources that currently exist. If you get your people on Medicaid, these are things that are just afforded to them,
Mm.
right? Because they're on this program. Or these are ways that we can change the program to better support them and we can ask for that support. Or I bring in one of my nurse mentors who I subcontracts with me often. She can bring in this experience of, like, okay, and this is how it looks like when you're in the hospital and you're having that
Oh, sure.
conversation. And these are things that you should ask about. These are things that we need to take note of. These are the tests that we should be thinking about and letting people in community understand, like, this is what this exam means. This is what this test means. I have another expert who's an expert in global health and development and can, like, take it to another lens. So much of the work I do is collaborative by nature, um, because it's just like we can we think we're talking about something that's just like right here,
Yeah.
when in reality it's like all around us and it connects to so many different things.
Now, if
So,
I wanted to find your business,
yeah.
how would I go about doing that?
Yes, so you can go to C4C Consultants with an S at the end of consultants .com, and all of the information is there about the type of work I do. There's a contact form if you want to reach out to me if you're interested in working with me. There's a list of past collaborators and organizations that I've worked with if you're like, what is the pedigree?
Sure.
Or anything like that. But that's all there. Even some of my own work that I've done that I highlight on there, like my professional
Mm,
highlights are on there. So if you want to know more about some of the work I've done abroad or the work I've done
I do
in
want to know more.
community or anything like that, some examples, right, of the work I do, it's all there. I'm also can be found on LinkedIn. So on LinkedIn, I just under Abiola AB, yeah, A hyphen B. I'm like, what is my LinkedIn?
Okay.
It's
Okay.
Abiola A hyphen B on LinkedIn. And you can find me on LinkedIn, a lot of cross referencing. So if you're like, okay, it's easier to remember the LinkedIn,
Sure.
my website's on there, vice versa. And then for any of the doula work or
I was
maternal
about to
health
ask
work,
you.
yes. So a BA Collective is the name of our organization, and our website is abacollective.com. And then we have social media handles. So we're
Oh,
also on Instagram at abiye.co. And a BA is spelled ABIYE. So it's abiye.co on Instagram. We're also on LinkedIn at a BA Collective. And then we have our website, abacollective.com.
fantastic. I'm looking. We actually do have 1 or 2 minutes, and so this question came up in my mind while you were discussing a BA. Um, you mentioned engaging from the kind of a grassroots level to politicians, but some of the work you described sounds like work that the state should be doing on its own anyway. So, are they engaging with you? Okay,
Yes.
good.
So I have great friends
It's like,
who are in that
actually,
space. The state is actually doing a lot right now when it comes to maternal health. I don't want to say a lot, right? We could all be doing more.
sure.
Don't get too comfortable. But there's great stuff happening at a state level, especially around doulas, especially around Medicaid reimbursement for doulas. So now there's a high demand, right? We know that or sorry, about 9 in 10 of people who give birth on Medicaid are Black birthing
Oh, okay.
people, or Native
I
American
didn't
birthing
know that.
people as well. So there's a high demand for doulas in the Medicaid space, and especially doulas who are representative, whether it be culturally, racially, in those ways, linguistically. So there's a high demand for doulas, but the reimbursement rate was not there before. So especially this last legislative season, we've done a lot of work. Me and my sister and a lot of other dudes have done a lot of work with the state, with the counties, with CMS to really get that in a space that's equitable
Yeah.
for doulas to make a living wage, but also supports the great demand for doulas across the state, especially for those on Medicaid. So,
Wonderful. Thank you for that last
yes,
example.
yeah.
And thank you for this fantastic conversation. This has been really, really fantastic. I encourage you all to reach out. We will list out all of those links, all of that contact information, and the LinkedIn. Dr. Abiola Abu-Bakr. It has been a pleasure.
Thank you. It's been
Thank
really
you.
great talking to you.
Yay. And as always, this is Bottomless Coffee with Jerome. You can stream all of our episodes at bottomlesscoffeeshow.com. Thank you so much for tuning in. See you next time.